Biospecimens and biobanking help researchers find out more information about the different types of cancers. Biospecimens are specimens, such as blood and tissue, which are saved after the diagnosis is made for a patient. These specimens are donated for research. Biospecimens may be collected through biopsy, blood draw, urine collection, surgery, or a cheek swab. These biospecimens are annotated to help inform research. Information that is saved with the specimen includes the age, gender, and ethnicity of the patient. Annotations also include any environmental factors and the type of cancer. A biorepository is a facility where they store biospecimens for research. These facilities are equipped to keep specimens at the right temperature and in perfect conditions so they can be studied and to prevent deterioration. It's important to keep specimens viable during collection and storage in order to conduct accurate research. Human fluids and tissue can be vulnerable to deterioration, so a set protocol is in place to protect the biospecimen during collection and transport. A donor's privacy is protected when they offer biospecimens for research. Specimens are coded, so the patient's name is not readily available with the specimen. Biospecimens are an integral part of the research process. These samples can be used to help propel future research and develop better therapies. They can also be saved for prolonged periods and used for later research. Biospecimens can help target therapy and create drugs that work better for treatments of specific cancers and certain sets of the population. This practice has helped researchers move to a more personalized approach to cancer treatment. Personalized medicine lets researchers identify the genetic differences between people and how they impact therapies. For instance, some medicines will work better for person A than they will for person B. With this information, physicians can project how well a patient will respond to specific therapies, allowing for better treatment protocol and more successful outcomes. There are ethics observed in biospecimen collection. Bioethics insist that the original donor patient is always given a choice of consent. Samples are never taken without the patient's knowledge. The practice of using biospecimens, the data collected and results, help our medical community evolve and develop life-saving therapies. The donor patient will receive results on their own tests, but they are not given the results of the study their sample is used in. In fact, research may go on for many years with one biospecimen, and it may result in a variety of therapies. Donors should know that the specimen can be used for many years to come and will benefit the scientific community as well as future sufferers of the same cancer. In some cases, samples may help clarify better ways to treat and prevent disease within a set community, ethnic, or racial group. Patients should be offered informed consent, as outlined in the 1979 Belmont Report. Informed consent means that the process is explained to them and that it's verified that the donor understands how the specimen will be collected and used. Their consent must also be voluntary. There are a lot of benefits to donating specimens. It can aid research to come up with new treatments to improve health and diminish the level of pain. It can help researchers fine-tune diagnosis and therapy, and it can also be beneficial for treatment in set communities. There may be some risks that donors should be aware of before consenting, such as pain and swelling from the process. You should also be aware that the Genetic Information Non-Discrimination Act, GINA, protects you from discrimination based on genetic information.